Hi, my name is Kathleen Canoyer,
And I'm Kelly Collins.
and we work at Rhode Island Hospital, which is a Lifespan affiliate in the state of Rhode Island. We're managing a 26-bed medical telemetry unit, and 6 of the beds on that unit have been designated as a COMU unit, which is a close observation medical unit. Also, that area has been equipped with low beds, which provide, and mats, which provide for the patient's safety should there be a fall out of bed, and equipment such as
We have padding that can go on the bed, below the bedside, also to ensure there's, the safety. But we also have extra staff on. We have one nurse with 2 nursing assistants, all which been especially trained in the geriatric area on dementia and delirium.
all the patients in that little area are considered on fall precautions. So we do frequent rounding with them every hour at least, offering them and bringing them to the bathroom, getting them up ambulating. That unit is scheduled to have activities during the day. We get everybody up for breakfast. There's a common area where everybody will be sitting around a table, so there is some communal dining. All those patients are expected to be out of bed, up and out of bed for breakfast. They are also, all meals that are in a shared area. They also have walking. We walk them
Plan.
frequently, and all the staff have been, especially the CNAs, have been trained with our physical therapists to ambulate patients and to move patients in a safe way for the patients as well as for the staff. There are specific gait belts that are used in that area, as well as walkers and all the implements that would better protect the patients when they are ambulating. We also have music therapy. We have quiet times. We have
Pet
pet
therapy.
therapy once a week, where the dogs come in and share some time in the back with the patients. We have a lot of bingo games and creative times with those patients. We've had many students of Brown University come in to play instruments. We had one gentleman who would come in once a week and do music therapy in a little setting that we sort of arranged like a little coffee house, so the patients could sit around and sing along and listen to some real pretty live music.
Our plan is to take back a lot of the initiatives back to our commune area as well as the Rhode Island Hospital to help us better prepare for our magnet journey. Just being able to have a close relationship with the family caregivers and have a better understanding who this person was at home. You go into the hospital and you don't know everyone's daily routine and you don't have a good understanding. So being able to ask the family member, who was this person? What was their orientation prior to their hospitalization? And what is their daily routine? That way we can try to do that the best as possible.
We have a fantastic social worker who gets involved with each family that needs assistance. We also have a geriatric nurse specialist who comes and gets involved with each family that requires some personal assistance. We've had great success transitioning several of our patients to a situations post-hospitalization that best meet the needs of the family as well as the patient. Close facsimile to their homes, and get the patient's families ready for a transition of the patient from a home setting to a facility setting or a palliative setting.
Our geriatric nurse practitioner is also a palliative care nurse who comes in and she does all the palliative care consults. And she does a really great job in incorporating the family as well as the patient's needs, for their journey to the end of life.
Mitch has been an incredible support of information and flow of information. It's a collegiality and with our focus and our goals, so it has provided great support and allowed for us to express a lot of what we have focused on in our own efforts. So it's been a very supportive tool, and it's something that we want to contribute to as a professional growth.
I think looking forward, taking back that don't reinvent the wheel, using all of the tools that Niche has provided for us to get our nurses, certified in geriatrics, and just using what's already been given to us, all the hard work that Niche has done to help Rhode Island Hospital become a hospital that has many certified geriatric nurses.